Ms. Blunt, Rochester is recognized for 5 minutes.
Thank you, Mr. Chairman.
Strike the last word.
I move to strike the last word, and it's been struck and stricken. Thank you, Mr. Chairman. I want to, first of all, say how very proud I am of the bipartisan work that has gone into this package, especially the reauthorization of several important public health programs. I'm particularly pleased at the progress we've made on the reauthorization of the Community Health Center Fund and the National Health Service Corps that is based on the work I did with my colleagues, Representatives Joyce, Fletcher, and Stefanik. The aims we are considering today would extend the Community Health Center Fund and the National Health Service Corps for 2 years and includes an increase providing near-term stability and predictability to health centers nationwide. This program is critical because health centers typically treat a sicker, poorer, and more diverse population than most other health care providers, serving 1 in 5 rural residents, 1 in 3 living in poverty, and over 400,000 veterans. And of the 30 million patients served by health centers, almost a third are children, and 11% are older than 65. A strong health center network is integral to promoting health equity and increasing access to primary and preventative care to people at every stage of life. And I would venture to guess that every member of this committee has constituents who have benefited from health center services. I hope that this reauthorization will be the beginning and not the end of the discussion. And I want to acknowledge the work that I've done with my colleagues, Representatives Barragan and Custer. Together, we put forth a policy to provide smart and targeted investments to help health centers deepen their services and address the most urgent issues facing Americans today, like the opioid crisis. Health centers have enormous potential to play in a leading role in reducing overdose deaths and improving the mental health of Americans. In 2021, 1 in 5 Americans had a mental health condition, and over 100,000 Americans died from drug overdoses. Behavioral health conditions are most prevalent among Medicaid enrollees, which is also the largest population served by health centers. And although most health centers provide mental health and substance use disorder care, they are currently not required to do so. Health centers saw an increase of 138,000 patients for behavioral health visits between 2020 and 2021. But despite their efforts, health centers are only meeting 27% of the demand for mental health services, 27%, and 6% for the demand of substance use disorder services among their patients due to resource constraints. Therefore, millions of healthcare center patients still lack access to those critical services, including mental health and addiction treatment. I encourage members to take a look at our bill, H.R. 3080, and the President's proposal because I think it lays out a clear and compelling justification for why health centers should be given more resources. I look forward to continuing the conversation, and I urge my colleagues to support this aims. Thank you, and I yield back, Mr. Chairman.